Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. In April of 2021, the Methodist hospital system implemented a mandatory COVID-19 immunization policy for all of its employees and vendors. The plaintiffs refused to comply and had their jobs or vendor privileges terminated. District Court Judge George C. Hanks Jr. upheld the defendant's mandate, concluding that the plaintiffs do not have a fundamental right to refuse vaccination and the COVID-19 vaccine mandates are rationally related to a legitimate state interest. In other words, the defendant's mandate was in the best interest of safety and stopping the spread of the virus. But how can that be when the vaccine was never even tested as to whether or not it could stop spreading? America's Frontline Doctors maintains the position that these experimental mRNA injections are not vaccines at all. Failing to prevent infection or transmission, the COVID shots are personal medical treatments only. Further, vast scientific research and evidence have proven these vaccines to be neither safe nor effective. In dismissing the plaintiff's claims, the lower court relied on the now disproven safe and effective narrative. Further, the defendants engaged in unconstitutional, illegal, and possible criminal activity by mandating dangerous experimental medical treatments in violation of numerous well-established laws and regulations. If left unchecked by the courts, these unlawful violations are likely to recur in the future. The Fifth Circuit must firmly reject the defendant's mandate by reversing the lower court's deeply flawed ruling. AFLDS attorney David Dahlia states, quote, "As most people now know, the COVID shots are neither safe nor effective. This was not disclosed to those who were coerced into taking these injections under the threat of job termination." As of November 29th of 2024, the CDC's vaccine adverse events reporting system logged over 38,000 attributable deaths and countless serious adverse reactions since these experimental injections were introduced around 2021. 2 American states and several European countries no longer recommend these injections. No public or private institution should ever illegally mandate such risky and dangerous shots again. After all, how can anyone attempt to mandate anything that might kill you? We are hopeful that the Fifth Circuit will invalidate this hospital mandate, end quote. AFLDS founder and president Dr. Simone Gold added, quote, "Voluntary, coercion-free, and fully informed consent to medical treatments is not only essential, but legally required. As the lessons of Nuremberg and the Tuskegee experiment teach, forced medical experimentation on human beings is reprehensible and must not be upheld by any court. Tyranny can only persist if we allow it. These unlawful mandates must be swiftly and unanimously rejected," end quote. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.